Hello, I'm Kayla Roman, and I will be highlighting top professionals providing senior financial services. Today, we are meeting with Tina. Hi, Tina.
Hi, Kayla.
How are you today?
I'm great. How are you?
I'm good. Thank you so much for taking the time to meet with me today. If you wanted to, could you just start off by telling us a little bit about yourself, your hobbies, what you like to do in your free time?
Sure. Yeah, my name is Tina Garrity, and my husband and I own a insurance agency that specializes in helping seniors find the best plan for them. It's called Tri-State Senior Insurance. And we operate out of the Health Insurance Enrollment Center, which I'll talk about a little bit later. We are a husband and wife work team, so we do put in a lot of hours to our business. Fortunately, we love what we do. So that's a big part of my life at this point, but we also have a beautiful family. Our son, Danny, is 23, oh goodness, turning 24 in November. He is finishing up some schooling and working, and our daughter Christina is 19 and she is starting her freshman year in college.
Woohoo.
So we have just become empty nesters. It does not feel empty at all because we are very occupied with our business, our little dog Macy. I have quite a few interests. I love to walk, do sing in a couple bands. I like Irish music. I also sing weddings at church, and so we're active in a lot of different ways. We like to ski, play pickleball a little bit, and try to enjoy life as much as possible now that we're empty nesters. And it's funny because when I first started in this business, I used to refer to my parents very often as the model, but I'm getting closer and closer to the age of the people that we work with. So now my clients have become, instead of my parents' age, they've become close to our own age, or at least an older sibling's age. So that's a little bit the long and short of who I am.
Sounds like
When
you
I,
stay really busy. It's cool that you like to sing Irish music. I was just in Ireland last October, so
oh, it's
love the
beautiful.
culture.
Yeah, it's beautiful. We would love to go back. We've not been there in quite a few years. So maybe the empty nest at some point will give us some time to do a little bit of traveling and do things like that.
Yeah. What made you get into insurance in general?
I was, before my children were born, I did work actually in the insurance space, also in pharmaceutical industry. And so I had a background in that. And as the kids were approaching full-time school, I started to look at options for, kind of getting back to work full-time. And someone was talking to me about this profession and what they did, and I was really listening and started researching how I could go about being an insurance specialist in the healthcare Medicare space. And I understood that I had to take a test, so I spent Christina's end of her kindergarten year kind of studying for a test, took the test, passed it. One thing I knew is that I did not want to work for a specific insurance company. I really wanted to be free to offer clients products across the board so that I wasn't strapped to offering one particular type of product or one particular company. And so it really was attractive to me. And at that time, I just quite frankly got very lucky that someone called me and said, "Hey, I heard you got your insurance license," and introduced me to the business. And I kind of started working in the fall of my daughter's first grade year. And then within a few years of that, I realized the potential and how much I enjoyed it. And I formed an LLC. And at that time, that's when I formed my company, Tri-State Senior Consultants, which has become Tri-State Senior Insurance.
Thank you so much for sharing that. Could you describe to me some of the biggest challenges that you see your clients facing, and what are like some of the biggest concerns that you help them resolve?
Well, I think what's happened over the years, I've seen a definite shift. I've been doing this for 13 years. When I first started in this industry, I'll tell you what people were not concerned about. People were not really concerned about dental insurance 13 years ago. People were also not as concerned about covering their prescription drugs as they are today. And I would say the two things that I find that have really been a difference is people are much more concerned about dental insurance in today's world than they used to be. People are also much more concerned about their prescription drugs than they used to be. And I think that probably has something to do with the fact that there are a lot more medications in the market today to treat things that did not exist 13 years ago. And I find that fascinating because I come from the pharmaceutical background as well. So part of the job for me in that context is very interesting and exciting. And I understand it a lot better than probably a lot of my colleagues, because when I go over people's medications, people are always like, oh my gosh, how do you know all these medications? And it's because I come from that background. So there are a lot of medications in today's world that are brand name medications because they're newer agents that didn't exist 13 years ago. And quite frankly, they're a bit more expensive. And so I find I have to be a lot more sensitive to the fact that my seniors are on a fixed income and they are put on medications that, quite frankly, can be very expensive. So the challenge of finding prescription drug coverage that is affordable for them is definitely a thing. And then 13 years ago, when I was meeting with people, they were not going to the dentist as frequently as my clients today are. I don't know about you, but I get cleanings of my teeth twice a year. I'm very thorough about my dental health because it's very well documented that what happens in your dental health spills over to your medical health, right? Because your teeth are in your body. I think the dental component has become much more important over the last 13 years, and I've seen a shift there. And it's very fascinating to me. So I would say those are two things that I have seen change the most drastically.
Without divulging any specific details, can you tell me about a time where you helped a client achieve one of these goals or overcome one of these challenges?
Yeah, absolutely. I mean, quite frankly, it happens almost every day. I mean, I just yesterday, I'll give an example. I was meeting with someone who was spending about $6,000 out of their pocket for their medical and prescription drug coverage. They were way overpaying for their medications, and they had no dental insurance whatsoever. And so I was able to help them find a plan to cover those expenses in a much more affordable way and to wrap some dental coverage into that plan. It does not always happen that way. There are some situations where I can just think of another client a few weeks back that is a current client of mine that I approached because I saw their premiums for a certain plan were getting very high. And I approached them and said, listen, we might be able to do better. We found a much more affordable plan it was actually the same exact plan that they had. It was just with a different company. And I was able to get them a much cheaper rate. We still kept the format of the coverage they had. So they chose not to wrap in any dental coverage at this time. So it doesn't always happen like that, but I was still able to save them a lot of money. So there are situations that come into us all of the time. I mean, we're very blessed here at Tri-State Senior Insurance because not only do we have myself, my husband, but there are 8 other agents that work with us. So there's a total of 10 of us currently at the time who service the Pennsylvania, New Jersey, Delaware market. We're in the tri-state region. And we are able to, through either having people come into our health insurance enrollment center at the Minoa Shopping Center in Havertown, people can either come there and meet with us, or we meet by Zoom, just like you and I are doing right now. And then also too, we sometimes go to people's homes to kind of decipher what their specific situation is and try to make improvements. especially during the annual election period. Every year during the annual election period, Medicare beneficiaries have the ability from October 15th to December 7th to make a change. So we're certainly busy during that time, but also too, of course, there are always people who are turning 65 who are possibly transitioning to Medicare or need some advice as to whether they should transition to Medicare. And then also during the off season, outside of the annual election period, we meet with people all the time because there are possibilities for people to make changes sometimes that they don't even realize. And so the people I'm talking about that I met with yesterday, in fact, we're going to be making a change to their plan as of October 1st. Even we don't have to wait till the annual election period because of their specific situation. And that happens all the time. So our team are really incredibly well trained and are able to figure out whether people can make changes, not just during the annual election period, but at any time during the year. So there's a couple of examples for you.
Yeah, thank you. One more question for you, and we won't hold you to it. But if you had a crystal ball and you could see into the future for the next 3 to 5 years, what do you think is going to be the biggest challenge for seniors with insurance?
Well, I think that the challenges of today, quite frankly, are going to continue. So I do think the challenges for seniors to cover their prescription drugs, unfortunately, is here to stay. And I see that being a challenge for my clients in the future. There is some legislation that has been passed recently that will affect the amount of money seniors are paying for their medications on a monthly basis for a standalone prescription drug program. It's already starting to happen in 2024. It will happen even more so in 2025. And that will affect prescription drug plans across the board, really. And I see that as a challenge for my client, but I also see that as an opportunity because for every challenge, there's always an opportunity, right? So there's an opportunity for us as agents to try to help our clients navigate this space and figure out where they can possibly make adjustments to help cover their medications. And remember, not every Medicare beneficiary is on a long list of medications. There are some Medicare beneficiaries that, quite frankly, are not on very many medications at all. There are some people who are not in that situation. Even though they're not on many medications, they still need to navigate the Medicare space and get some prescription drug coverage, affordable prescription drug coverage that they're not paying an arm and a leg for, especially because they're not on a lot of medications. So we'll continue to have that challenge. We will also continue to have the challenge of finding extra coverage for our clients. As mentioned, dental, vision, hearing benefits, things of that nature. So I see the challenges of today will continue, but I also see that there will be more and more affordable solutions for clients going forward to try to navigate these spaces.
Okay. Well, thank you so much for meeting with me today and tell me a little bit about yourself and about your business. I really appreciate it.
Thank you, Kayla, for having me. I really appreciate it. And for anyone listening, please feel free to visit us on our website, www.tristateseniors.com. You can also come visit us at the Health Insurance Enrollment Center in the Manoa Shopping Plaza in Havertown. Our number is 610-355-4699. And I'm sure Kayla will continue to give you our information. But thank you so much for having me, and have a great day.
All right. Thanks, Tina.